Warm welcome to everybody who has joined the session today. And today I'll be talking about a very important uh, news which has been circulating. And so we'll be talking about something which is important for anybody who's either trying to lose weight or already is following a weight loss program. Now, what is the news which has come in? And the news is that some people who have lost weight very, very quickly are suffering from paralysis. So, what is really happening? Why are these people suddenly suffering from paralysis? So, according to one of the case studies, one woman about 46 years of age, she was given a medicine which is called semaglutide for weight loss. And she started losing weight very fast. Almost she was losing more than 5-6 kilos in a month. What was the reason that the paralysis happened? So the paralysis happened because there was metabolic imbalance. And this metabolic imbalance happened because of this extremely fast weight loss. Now, most people want quick weight loss. They want that we should lose weight fast. And that is why faster the weight loss, the happier they are. So how do we define rapid weight loss? Anything more than 2.5 kilos a month is rapid weight loss. And if it is done continuously for 3 months or even more than 2.5 months, so a paralysis can happen. Now, the reason is that why is paralysis happening with rapid weight loss? Like I said, rapid weight loss is that every month you are losing more than 5 kilos. And this is called rapid weight loss because the normal healthy weight loss is 2.5 kilos. And rapid weight loss is if you're losing 5 kilos, I mean, double of normal weight loss. So you are losing 5 kilos a month continuously for 3 months, and then paralysis can happen. Now, a lot of people are wondering that why paralysis happens. Very simple, because when you lose weight very, very, very fast, the entire blood in your body, entire system in your body, there is metabolic imbalance. The electrolytes, they go into an imbalance because this is a very fast changes happening in the body. Added to that, people who take chemical medicines for weight loss. I've given an example, semaglutide. Not that semaglutide will affect everybody, but in some cases, this has been seen according to the case study. Or some people, even in a bariatric surgery, it has been seen. Recently, there was a case of a weight loss trainer, an exercise trainer, who was taking some of these chemical supplements and doing this rapid weight loss. And he had put a target that I will lose some 10, 11 kilos in like 2-3 weeks. And he ended up in a paralysis. Now, the question is that when we lose weight very fast, like I said, more than 5 kilos a month, we are putting our entire liver and our fat metabolism into very high stress levels. And to lose that weight, it's literally extracting vitamins from the muscles, from the nerves. Plus, these people are also doing a zero fat diet. So in one case, a deficiency of a vitamin called thiamine was noticed because they were doing a very imbalanced zero fat weight loss. And because of that, a thiamine imbalance happened, which is a vitamin, and paralysis happened. So what are we trying to say? What we are trying to say is that when you lose weight and you use these fast track methods, it could be a drug, it could be a chemical, it could be a radical diet like a zero fat diet. It could be something like laxatives, which is to basically pass more stool, like cause a diarrhea like condition. or diuretics, which is to lose a lot of body water. When you use all these methodologies, what happens is that your body goes into imbalance. There is an electrolyte imbalance. In some cases, it affects the nerves and a paralysis happens. And around the nerve, this is the peroneal nerve, around this nerve, it goes to the leg. There is a fat covering, and this fat covering is around the bone. And this is lost, and this nerve is crushed or pressed. I wouldn't say crushed completely because it is reversible, but it's pressed, and paralysis or paresis happens. There is a foot drop, the foot just drops. So, what we must understand is that if we are trying to lose weight in an illogical, irrational fashion, which is faster the better, it can cause long-term damage. In some cases, there is kidney damage. In some cases, there is liver damage. In some cases, there is ulcers. So, weight loss is not something to play around with because it is a scientific process and it has to be done in a scientific process. And most long-term damage happens when people use a combination of crash diets and chemicals. So this combination is the worst, crash diet and chemicals. And why do people use chemicals? Obviously, to lose weight faster. And crash diet, obviously, because they want to lose weight faster. So a crash diet or a very low-calorie diet combined with chemicals is a recipe for disaster. And that is what is important, that when we are pursuing this path of health, why do people lose weight? To become healthy and to look good. But you cannot be losing weight by following a method which is so random and so radical that it can cause nerve damage. And that is why today's session, what we are doing is to educate people that weight loss is not something which you have to do it without scientific help or without scientific assistance. Because if you do it without scientific help or assistance and you follow these random methods plus use chemicals, the side effects are more long term. Now let's look at some of the common ways how people lose weight and fast weight loss. So some people, obviously, they take injections of Ozempic. And we will talk more about Ozempic in another video. But that fast weight loss can also trigger this slimmer's paralysis. Some people, after bariatric surgery, are not able to follow a nutritionally balanced program. They are not taking those vitamins and minerals, and they're not following a nutritionally balanced program, and continuously the body is losing weight. So they can also end up, there have been cases where even people with bariatric surgery have ended up with this. So that nutritional balance is the key to healthy weight loss. When I talk about nutritional balance, I'm talking about vitamins, vitamin A, B, C, D, E, K, and minerals like calcium, phosphorus, chromium, molybdenum, all these minerals. Another case where people have lost weight radically is obviously like in the case of this weight loss trainer, fitness trainer, come influencer, who was following a crash program. Plus, he was taking some chemical supplements also. Now, supplements are of various kinds. There are chemical supplements and then there are plant-based supplements. Now, chemical supplements are the more dangerous ones, which you should always take under supervision of a professional qualified person. You cannot take it just randomly on your own. So when I say professional qualified, it's better to have either a doctor or someone who's trained to handle that supplement. So that person, so chemical supplements are too powerful to be taken without knowledge. And then there are plant-based supplements, which are gentle and which are soft and which will not give you this kind of a radical weight loss. They will just support your metabolism. So chemical supplements is what I'm talking about today. There are many chemical supplements available in the market, many kind of what I would say weight loss supplements available in the market. Many of them are working on. So how do these supplements work? So many of them work on blocking our stomach receptors. So what happens is when they block our receptors, people feel full. They feel full very soon because the food in the stomach just stays there. It doesn't move because the receptors are blocked. So it becomes very sluggish and it moves slowly. So instead of the stomach emptying out in the normal time, the food just sits in the stomach. So obviously the person feels full. But these are chemical supplements. Another supplement could be working on the nerves. Another supplement could be working on your muscle protein. Another supplement is working on the liver metabolism. So, but if they are chemical, that means they are like a medicine and it should not be taken without consulting a doctor, without consulting a trained professional who handles these supplements. Now, another thing which we find very commonly is a lot of women are going for the zero fat diet, I would say. So I have also seen cases of people who go for these zero fat diets and then they're ending up with gallbladder stones. Why would somebody end up with a gallbladder stone if they're on a zero fat diet? Because when you go on a zero fat diet, the requirement of your body for essential fatty acids for your skin, for your eyes, for your nerves, that gets compromised. And then what happens is that your body starts extracting this from other areas in your system. And that leads to saturation and an acidic environment. And eventually, whenever there is a saturation, the bones start releasing calcium, and these calcium stones form in the liver and even in the kidney. Because the body becomes so acidic that calcium has to be taken out from the bones, which is an alkaline material, to make the body alkaline. And then this excessive calcium gets saturated and deposited in the liver and in the kidney. Another case where we have seen side effects of this fast weight loss program is somebody who wanted to go on as little calorie as possible and started taking a lot of diet sodas or zero cal drinks. And these zero cal drinks actually had a lot of chemicals in it. Plus, they had stimulants. So the person was trying to also control craving because when you don't eat anything, you feel hungry. So this person was drinking these zero cal drinks 4 to 5 a day. And what happened in 2 months, the person had a heart flutter, almost an arrhythmia, and was taken in the emergency to the ICU and admitted. And when they investigated, he had no heart blocks, he had no high blood pressure, but his arrhythmia, his heart flutter, was triggered by the chemical in those zero cal drinks because he was taking too much, 5 to 6 a day, because he was trying to control his cravings and he was trying to drink something which was zero cal. So when I'm talking about all these, I'm talking about all these because eventually when you follow any of these programs with lack of understanding about how human body works, it leads to long-term or short-term damage of your body. You are lucky if you escape with the short-term damage because some people end up with the long-term damage. And that is why it's very important that one should not take weight loss as a cosmetic or as a light or as a frivolous activity. Weight loss is a scientific activity. It's a medically it's an important activity for your health and should be understood medically. Your anatomy or physiology should be understood well. Only then can you do this activity and get results. So to all of you who are watching this program, we try to demystify and also bring to you all information in the industry and the market connected to weight loss. We talk about weight loss medications, we talk about weight loss supplements, we talk about weight loss diet plans, and we talk about science and the pros and cons. And if you're interested to know more, or if you're interested to join more sessions, just direct message your number, and we are happy to include you in our invitation guest list, because we keep having these sessions, educational sessions, awareness sessions for each one of you. So keep watching if you want to lose weight in a healthy fashion. And if you want to lose weight in a healthy fashion, reach out to us, and we'll help you, guide you, support you in the decision to become healthy. So, with that, thank you so much for joining today, and wish you a very healthy, happy January.